Hello out there, this is the irate veteran coming at you with another video. So you veterans out there who need some veteran to veteran advice, send me a email to my VA Madness Gmail address and I'll be happy to provide that advice. Just a note to you people out there who think my video or videos suck. If you would, instead of just saying you don't like them, marking that that you don't like the video, please tell me why. Because why I want to know that is because I'm presenting these videos to help veterans. And if you can help me do that better, that would be great, right? So veterans supporting veterans, right? Support me. Yes, you think I suck. Tell me why so I can stop that sucking, okay? All right. So those of you veterans who are fully familiar with the claims process, you can skip this particular slide, right? But for you people who have no idea what you're doing, that was me, some years ago. And boy, I wish this video was out there. So if I had to do it all over again, I would do it this way. But I do want to mention to you veterans who are open to it to seek help from a veteran service representative. Right? You can go to the VFW, American Legion, Order of the Purple Heart. There's all kinds of organizations out there that provide free representation to veterans. Right? So I just want to say that remember, as with all things out there, you're going to have people who are good at their jobs, and you're going to have people who suck at their jobs, right? And when you don't know what type of representative you're getting, right? So at some point, if they're either not keeping you informed or some of their advice doesn't sound right, well, shoot me an email and ask. I'll be more than happy to say, you're right, they suck. Right? But like I said, some of them really know what they're doing. So, you might give them a shot. But for those of you who want to pursue it by yourself or who want to keep, you know, your representative, honest per se, right? Then, you might want to follow along. So anyway, if I had to do over again, I would do this. I would submit a VA form 210966 intent to file a claim form, right? Because what that does is preserve an effective date from the time the VA receives the 0966. You lock in a effective date for pay, right? Which is what you would like to do, especially like I said, you don't know what you're doing, right? So while you learn what to do, which is what you need to do next, right? And gather all the information you need while you're doing that, you're actually getting paid, right? So you want to do that. But you need to file your actual claim within a year of filing the intent to file a claim form, because they go together, right? So after you file the intent to file a claim form, then you go about doing the things you need to do to educate yourself about how to file a claim. Get a hold of if you've already have claims with the VA will have your claims file. Send for a copy of that. If you haven't updated that file in a while, you want to send for an updated copy of your C file to get a hold of any like compensation and pension exams that maybe you don't have a record of or whatever that's in your file that you don't have a copy of. You want to get an updated copy if you need it. For those of you who don't have any of your records, you'll want to submit for your personnel, health records, whatever, from the archives, which I have their address listed here. You can do that by fax, mail, or right there online. For those, this particular presentation is going to be on PTSD, so you'll also want to get a copy of your post-service mental health treatment records. And if you're filing other claims in addition to the PTSD, you'll want to submit a VA Form 214138, which is a statement in support of those other claims, as well as if you have claims other than your PTSD claim you're going to file at the same time, you'll want to, if possible, get your doctor to fill out a DBQ, which is a disability benefit questionnaire. That questionnaire has all the information that the VA needs to give you a proper rating, right? So I personally don't trust the VA to do that, right? So it up front, if you get that done, I think it's a big help, right? So um, once you have everything you need together, then you can go ahead and by the way, if you're filing for PTSD, of course, go through the rest of this video before you file your claim, right? And then, but once you have everything together, right, then submit the VA form 21526 EZ, right? And that, that right there will initiate then all of your claims. But what's going to happen then, once they receive that form, all the claims you have listed on that form, they're gonna now, marry that up with your intent to file a claim form, and all those effective dates will be from your intent to file form. Because realize it probably was going to take you some months to get all this information together. Why not get paid while you wait, right? So anyway, so let's move on to PTSD itself. DBQs for PTSD, you cannot have one filled out up front. Your initial PTSD for PTSD DBQ cannot be filled out by a private mental health provider. For whatever reason, the VA does not trust outside the VA mental health providers to do the initial DBQ, which is really stupid, if you ask me, because the DBQ, like I've already mentioned about DBQs, has all the things that would be necessary to get the proper rating. Why not have that all done up front? I have no idea why they make PTSD different from all other claims, but they do. It is what it is. So the only time a private health provider can fill out a DBQ for PTSD is uh, after you've already been service connected. So if you've been service connected, but you think your rating has come back and it's too low, then you can go to a private health provider because you're already service connected and have them fill out a DBQ to challenge that low rating you got, right? Or at some point in the future, if your PTSD gets worse, you can go to a private mental health provider and have them do a DBQ, so you can get your rating increased, right? But again, uh, DBQs are only for private health providers after you've been service connected. So let's move on to actual PTSD types. I have divided it into 5 situational based categories. Now, these are not VA type categories, right? I've divided them up to make it easier to explain. Why? Because depending on your situation, you may need more or less information, right? So, to make it simple, I've divided into these 5 categories. So, they are combat related and POW type PTSD, deployed, not combat related PTSD, incident related diagnosed in service PTSD, incident related not diagnosed in service PTSD, and military sexual trauma PTSD. Um, so those are the 5 categories. Let's go ahead and jump right into their explanations. Let me explain what combat related means per the VA. That's not me. Right? I'm just a messenger. This is their rule. If you were a former POW, if you were granted a combat award, if you were in a combat career field or combat service support career field, you can file a combat related PTSD claim because those individuals in those categories that I just mentioned, right, have a presumption that they were in combat, right? They have that um, benefit, right? If you weren't one of those categories, you cannot file a combat related PTSD claim because the VA said so, right? So it doesn't matter if you were in combat, right? If you were a non-combat career field and you do not have a combat award, right, you have to file one of the other types of PTSD, right, which is going to make you jump through a few more hoops, right? So, and it doesn't matter if you were actually in combat, right? So, yes, it doesn't matter if you were, a truck driver and your convoy was, surrounded by the enemy and you guys fought off wave after wave of enemy troops and, they were, artillery was, landing in your positions and tanks were attacking you and planes were dropping bombs on you. And, even then, you can't file a combat related claim. Why? Because the VA said so. That's just how it is. So I just want you to understand there's no exceptions to that, right? So let's move on to base PTSD criteria. All types, whatever category you're in, you have to have a current diagnosis for PTSD. There must be an in-service stressor, and a stressor is the event or the whatever happened to you that is causing your PTSD. That's the stressor or stressors, right? And there must be a link between your current PTSD and the in-service stressor, right? So those three factors, any type of PTSD, those things have to be shown. There's a lot of common factors. Your military records, your career field, your deployments, your awards, all those would be considered. Your records are what they are. So there's nothing you can do about that. Your initial diagnosis, though that is somewhat under your control. A compensation and pension exam, of course, that's not under your control, but all the gathered type evidence is under your control, and you may have to work at getting that information, whether it's, like the stressor statement, how you choose to write that, that's your business, right? Witness statements, if you need them or want them, you'll have to go get them. Uh, uh, Post-service mental health records, up to you to go get them. Police records, drug and alcohol treatment records, media reports, whatever it might be to support your claim, it's up to you to go get all of that, right? The VA's very little help in those situations, right? So one thing I want to mention about mental health records. Well, first of all, let me give you a piece of advice. If you have a diagnosis or think you have PTSD, go seek help. If you're having problems, uh, you know, some treatment is your best only option, right? In To get better. So, go check it out. Some veterans, I understand, make a lot of progress and they feel a lot better after they get treatment. Maybe it doesn't work for all veterans, but you won't know unless you try. So, first of all, get that help. But there's another reason here, and that is if you're not in treatment, but this goes for any type of claim. If you're not actively seeking treatment for something, it looks like there's nothing wrong with you. There's a belief amongst adjudicators as well as BVA judges that, if you're not in treatment, it's like a mark against you, right? Now, so besides you should seek treatment for your own peace of mind, it also is a element that is relevant in actually deciding your claim, right? So, but let's move on to the DSM. That's the Diagnostic and Statistical Manual for Mental Disorders. That is the Bible for your mental health professionals. Your initial diagnosis does not have to come from a psychiatrist or psychologist. It can come from basically anyone who has the training and is authorized to give that advice. But I do want to say that a strong diagnosis per the DSM is very helpful in PTSD claims, right? So I personally would only trust that to people at the top of the field, psychologists, psychiatrists, people who have, obvious training, because they live the DSM. I'm thinking the best diagnosis you're going to get is from the people at the top. So my advice to you is that I have gotten a lot of questions on, well, what do I say? Who do I, or even my psychologist says, is there anything special I have to do for the VA? Well, there is something you can do, right? And that is get a copy of that initial PTSD DBQ that the VA won't accept from a private provider, and it's listed here, VA Form 210960P4. That particular form has all the information required by the VA to give you the proper rating, right? And if it would be helpful for your mental health provider in giving you your initial diagnosis to review that and use it as a guide for how they fill out your diagnosis. Not only per the DSM, but if they could hit on some key factors that are listed on the DBQ, right? For example, I have the things listed here. Are there other conditions? It would be helpful if they mention those other conditions, right? And especially if it's related to your service, right? And all the different diagnostic criteria, how that was, everything might not apply. To note the things that do apply, right? To mention that they reviewed your records. It's specifically what they reviewed. Was it your DD-214 they looked at to show that you had combat service? Your service treatment records, your post mental health records, your stressor statement. Very important for them to mention that they, so. As you see here, the actual stressors, if they would mention that and how it's related to your PTSD, your symptoms, occupational and social impairments, and would be great if they commented on how the PTSD affects your ability to work, right? So there's a lot of very useful things in that DBQ, right? To where why you can't use, why they don't accept it, I have no idea, because it really has all the relevant information that you would want to have in your initial diagnosis. So, like I said, it would be great if you could get your psychologist, psychiatrist, whatever, to use it as a guide so that they can mention how some of these issues actually in your diagnosis, right? Because a very strong diagnosis, like I said, is going to be a very, very positive factor in winning your claim, right? So, and that's the goal here, right? So let's move on. Now, all of us, for the most part, everyone's going to go through a PTSD compensation and pension exam. One thing that would be very helpful, and not just for the exam, but for you personally, is learn about PTSD. It's I think it's the more you know how it affects you, the better you're going to be able to help yourself understand what's going on. And but by learning all the factors in PTSD and how it affects your daily life, and you know what, keep a record or a diary, right? So that you can say, wow, and understand how you feel relates to PTSD. But for the exam purposes, it would be great for you to realize when they're asking you questions, and they will ask you personal questions, and sometimes questions that, if you're not prepared for, may seem confrontational even. You don't want to make this a adversarial type exam. You want the exam to go as smoothly as possible for your sake and the examiner's sake. So by understanding how PTSD affects you and the terms that will be used, right, it's going to help your exam go really smooth, right? And that's one of the things you want to happen, right? So educate yourself. Once you're at the exam, there is going to be some testing, right? It's not a test, right? But some testing. And it's going to be likely, I mean, I'm sure at some time in the future they might change it up, right? But right now they're giving the Minnesota Multifaceted Personality Inventory. The MMPI-2 is what I took, which is 567 true and false questions. Took me about an hour and a half, and it's given either before or after the exam, right? So if now, like I'm pointing out, it's true and false questions, not right and wrong questions, right? What they're trying to do is find out where you fit within certain categories from a psychological perspective, right? Now, you can go on the internet, you can look up what these categories are and, see what they're trying to do, right? But there's no way to like study for the test or, like I said, they're not right and wrong answers. They're just trying to see where you fit, right? So just go take the test. And to me, I just took the test. I didn't think a lot about it. They had a question, true or false. I just answered it and moved along. Right? So I'm don't spend a lot of time like wondering how to answer the question. Most of them, I mean, there's just straightforward questions. Answer them. When you actually go in for the exam, my exam took about 2 hours. One of the things I absolutely will tell you is be honest and be yourself, right? Don't make any attempt to study up or try to make things seem worse or better than they are. Just be honest, be yourself, and tell them how it is, right? Because, I really think, especially for a mental health professional, they can read you, right? I mean, so just be yourself, and I think everything will be fine, right? I do want to say to be careful what you say, and I'm just saying that is in that don't make a big deal out of something that's not a big deal, right? So they're going to ask you about your childhood. They're going to ask you about your marriage if you're married, or your girlfriends if you have one. They're going to ask you about your mother. They're going to ask you uh, all the things. I mean, if anyone's been to any of these type of, they're going to ask you all kinds of personal questions, right? And if something really was a big deal, of course, elaborate. But if you and your brother used to fight, don't spend 20 minutes talking about all these fights, because maybe you're overemphasizing something that really didn't mean anything, right? So I'm just saying, don't dwell on something like I'm doing right now, right? If you don't need to, right? So also, probably bring a friend with you. You don't know how the day of the exam, you might be affected. Personally, the day of the exam, I did have something happen to me that, by the way, happens all too often. But I do find sometimes for some reason, I just lose track of what I was doing, where I was going. Weird as hell. I don't know why it happens. But it happened that day. I was 20 minutes late for my exam. And I was there. I was there way early. I took that. I did their testing, and I had about an hour and a half before the actual psychological exam. So I went to get a bite to eat down at the cafeteria, which was at the other end of the hospital. And I don't know what happened. It was about an hour after I went to eat. I found myself at the further end of the hospital. Anyway, what I'm saying is, by the time I figured out what was going on, I was late. Luckily, I was still able to be seen. You don't want that to happen to you. Being late's a bad thing, right? Bring a friend with you, right? And it couldn't hurt, right? So, okay. Now we're going to get right into the types. And we've already covered what combat related is, which I have listed again here at the top. But again, you're going to need that initial diagnosis for PTSD, right? Another thing you're going to need with your claim is you have to fill out a stressor statement. That's on VA form 210781, which is basically a statement in support of your claim, right? For PTSD, right? So That stressor statement for this particular type of PTSD, you don't have to be very detailed at all. If you want to be detailed, you can knock yourself out. But it's not required that you do. You don't have to list a specific stressor for this type of PTSD claim, right? You can make it as simple as this little sentence that I have here. CDD 214 verifying combat related award. And as a result of being in combat, I was in constant fear for my life. Bang. That's all you need. Per VA policy, once they verify that you are in a combat related type, you meet the criteria above, and that you're claiming PTSD, their next job is to schedule a compensation and pension exam, right? So, but like I said, if you want to go through and list all of your stressors, you can, right? I'm just saying, to me, I'm a keep it simple person, right? So this is keeping it simple, right? And that's how I would do it. You can do it another way, it's up to you, right? Because your own testimony is sufficient to establish anything you say happened, right? You don't need any witnesses. You don't need to go through any other effort. Your own statement is all you need, right? So when you go to your compensation and pension exam, and you likely will, although in the VA policy is that you only have to go to a PTS or a compensation and pension exam for this category, is if it's necessary. And I kind of looked at a lot of things why it would be necessary, and it looks like what the VA considers it would be necessary is if they don't have everything they need to rate you on hand, right? And since they won't let you get a DBQ filled out by an outside the VA provider, um, obviously you're going to have to go to a compensation and pension exam, right? Because the only way to get the proper information is to have a DBQ done for your rating. So now at your examination, your compensation and pension exam, they're going to have to establish that there is that link between your PTSD and your in-service stressor, right? So they're going to have to confirm that. So yes, they're going to talk about all your stressors or whatever you talk about as your stressors in your exam. Now, if you're like me, I had lots of stressors, right? How long do they have for these exams, right? I mean, so yes, you're only going to have time to talk about a stressor or two, right? So, so they're definitely going to ask about those things. So even if you haven't listed those stressors in your stressor statement, you're going to have to talk about those in the exam, right? Because again, the only way they're going to be able to link those stressors to your current PTSD is for you to talk about them, right? As well as, of course, they're going to talk about all those other issues too, right? You know, your relationships and whatnot, because they have to exclude other possibilities causing your PTSD, uh, other than your combat-related stressors, right? So anyway, that's basically all there is to it, right? And if you hear some of the awards for that qualify, of course, most people are probably familiar with these, right? So for you non-combat veterans, if you have a Purple Heart, you can file for combat-related PTSD. For those of you who were in a hostile environment, and even if and you were in combat, but you don't fall in one of the categories that allow you to file a combat related PTSD claim, you'll want to file basically what they call a due to fear of hostile military or terrorist activity type claim, right? Which means you were deployed, but per the VA's definition, you weren't in combat, right? So again, to file this type of claim, you're going to have to say, or you're going to have a diagnosis of PTSD. You your personnel records are going to have to show you were deployed to one of the hostile environments, and you're going to also have to fill out a stressor statement. Now, again, how detailed for this type of claim that you want to be is up to you. You can go through and list all of your stressors in detail if you want to, but you can do something as simple as I have here, which just states, after being assigned to Iraq, I was in constant fear of hostile military or terrorist activity. I was exposed to actual and or perceived sniper fire, IED explosions, direct fire, and other hostile acts on multiple occasions. Now, if you did serve in these locations, of course, you likely were exposed to a lot of these things, if not all of these things. List whatever's relevant for you in your stressor statement, or if you want, describe the actual incidents, right? But you don't have to in your stressor statement, right? And your own testimony is sufficient to establish that whatever you say happened, happened, right? So, um, you don't need any witnesses, right? Or anything else. Your own statement's good to go, right? So now when you go to your compensation and pension exam, there's a few more things your examiner is going to have to determine, right? Again, even whatever you listed on your stressor statement, if you listed the exact things or the specific incidents exactly, in any case in your exam, they're going to ask you about these specific instances, right? Listed or not, right? So the and they're going to have to say, is the stressor adequate to support the diagnosis of PTSD? They're also going to have to say, is the stressor related to fear of hostile military or terrorist activity? And they're going to have to say that your current PTSD and in-service stressor are related, right? That nexus is there, right? So there's a few more things that the examiner has to determine, right? So nothing you can do about that, right? But that's what they're going to have to do to get your, you know. And let me say one thing here about the stressor. Is the stressor? And I've talked to a lot of veterans that their claims have been denied because their stressor wasn't adequate to support a diagnosis. Again, depending on what that stressor is and if your examiner has any real knowledge of what it's like to be under what I want to say, life and death stressful situations. Uh, but the examiner is the one who's going to have to determine that. So if your stressor's something that maybe was stressful, such as, let's say you could hear combat off in the distance and, day after day, and, it just, caused your PTSD, I don't, I can't say if that would cause it or not, but the examiner is going to have to make a determination. And he may not think that, hearing distant combat, whether it's close or far away, is substantial enough to have caused your PTSD. So I'm just saying sometimes I do see these claims that uh, maybe the examiner doesn't realize. And is hearing combat from a distance stressful? Well, it was for me. Now, whether it didn't cause my PTSD for me, but I know it's stressful because when you know that there's some of your brother and sister soldiers out there, under attack, giving it or getting it, uh, yeah, it's stressful. My first reaction always was, let's go, let's go help, right? Let's move to the sound of the battle. But of course, you just can't leave your positions wherever you're at to do that. You have to get orders. And it's stressful knowing someone else might be taking a pounding and there's not a damn thing you can do about it, right? Yeah, that's stressful. Um, and it's also, also knowing, you know, all right, we should now, there's people under attack right now, we could be next, right? It's stressful knowing that, and you need to start preparing yourself, right? So what I'm saying is those examiners, for the most part, they don't know really. But unfortunately, they're the ones who've got to make the determination. So if you get denied for that, uh, don't lose heart. You can file an appeal. But anyway, moving on. Diagnosed in service, not combat-related PTSD. If, like with any claim, if you've been diagnosed in service, that's half the battle, right? To winning your claim, if not most of the battle, right? So all I do want to say is file your claim right away. Don't wait, right? So because if you do wait, remember, you have to have a current diagnosis of PTSD, right? So if you wait too long, they're probably not going to let your in-service diagnosis, qualify as current, right? So file right away if you can, right? So also, for this category, there is a note in that could disqualify you from filing this type of claim. What the note in the VA policy is if that initial diagnosis in service was correct or was followed the DSM properly, right? So I mean, so they leave themselves an out to say your diagnosis in service didn't follow the DSM and thus you can't file this type of claim based on a diagnosis in service, right? So just be aware of that depending who you've seen while you were in the military, and I know you don't always see a psychologist. I know I think they call it mental hygienists. I don't know what the hell they call them, but whatever they are, they're not psychologists, right? Or psychiatrists, right? So maybe they didn't follow the DSM as to issue a correct diagnosis. I don't know, but the VA has like an out here, right? So just be aware of that. But for the most part, if they did it correctly while you're in service, you can file this type of claim. Now, you'll still have to file a stressor statement, right, and describe the stressor in detail. But your own testimony is sufficient to establish the occurrence of the inserted stressor. You do not have to have any witnesses or anything to this, as long as it was diagnosed in service, right? And it was a correct diagnosis, or had all the elements that it needed, right, per the DSM, right? So, of course, you're going to have to go to that PTSD exam. Again, they're going to, they're going to have to establish that there is that link between your current PTSD and in-service stressor. So they have to confirm that nexus, right, during the exam, right? So, and that's all there is to that type. Now we get to the most difficult of all types of PTSD, which is incident related. Again, you have to have a diagnosis of PTSD. You'll have to fill out a stressor statement, and you'll have to describe the incident in as much detail as you can. But here's the kicker, and this is why it's very difficult, right? Because there must be supporting evidence that the incident occurred and that you were involved or witnessed that event firsthand, right? Often we can establish that, and I've helped veterans look at claims like this to where, yes, it was easy to establish the incident occurred in some cases, but establishing that they were there when it happened, that's where the problem comes in, right? And for this type of claim, you have to, there must be something that establishes that you were there. And I mean, like for instance, let's you have a buddy statement that can be written that says you were there. Well, then you would have to prove that he was there in order to say you were there, right? So it can be a pain in to file this, because often people are filing these claims many years after the incident, and especially with all the downsizings that's happened in the military over the years, over the last 10, 15, 20 years, that a lot of information is just not around anymore, right? So it makes this type, getting the evidence you need to support this, very difficult, right? But if you do enough digging, and again, for the most part, you're going to have to do the digging. Yes, the VA will try to help you establish the incident by looking through the relevant records, right? But as far as establishing that you were there or not, that's on you, right? And that is, like I said, the difficult part. Again, once you go to the PTSD exam, a compensation and pension exam, they're going to have to confirm that there's a nexus, that link between your current PTSD and the in-service stressor. Moving on to military sexual trauma, MST. Again, you're going to have a diagnosis for PTSD. You're going to have to fill out a stressor statement. In this case, it's a different form from which is VA Form 210781 Alpha, which is a statement of support of personal assault, right? So claim. So you're going to have to describe the incident in as much detail as you can recall. Details are important to help you establish, that what happened. Um, there must be supporting evidence that the incident occurred. I have some examples of the types of evidence. Most of these types of evidence, this apply to any claim where it may be relevant, right? And not just MST. Unit logs, service medical records, law enforcement records, rape crisis center records, mental health counseling centers, pregnancy tests or tests for STDs, statements from various people uh, that you may have made after the incident. So there's a lot of, incident type evidence that you can look at. But often I know with sexual assault, there isn't a lot of evidence that the incident actually occurred, or maybe in some cases, no evidence that the incident occurs. It's just, your word, right? So, but if that's your case, all hope's not lost, because there's a secondary part that really comes into um, being for military sexual trauma cases, and that's is behavioral changes. It's another type of evidence that is very strong, and behavioral changes alone can establish everything, can establish the grounds to have you service connected, right? So it's very powerful evidence of behavioral changes, and that type of evidence, of course, is I have all listed here. I won't mention them all, but the idea here is before your assault you acted one way, and after your assault you now, you're acting differently. Your behaviors change due to your assault, right? And if you can show that with evidence, right, you can win your claim, right? So, and there's a lot of different types of evidence that they accept, right? I mean, statements from your partner at the time, for example. Maybe you guys broke up due to what happened, and maybe you provided an explanation for that breakup, or maybe you didn't. The whole point is, it's if it happened after the incident, it certainly shows your behavior changed, and if you're for instance, your supervisor says your performance changed. Um, if you have, you can get people to write statements that you became depressed or started suffering panic attacks or anxiety. I mean, all these things I have listed here that could show that your behavior was, directly impacted from your trauma, right? That, you can win your case. So if you can gather this type of evidence, it would be, very powerful type of evidence, and behavioral change type evidence alone could win your claim, right? Of course, you're still going to have to go to the compensation and pension exam, and they're going to have to confirm that there's a link between your current PTSD and the in-service stressor, right? So that's basically all there is to it, which is, which is a lot. right? So if anyone has any questions, again, just hit me up with an email. I'll be happy to answer. So I rate veteran out. Good luck out there.